Good morning. I'm Susan, and I am here today to discuss with you some of the items about the Fotona gynecology applications. We're going to go over the GSET and cleaning process, and also do a bit of a demonstration on thermal paper for the GSET with the wire speculum, with the clear speculum, and then also you will get a chance to see the G-Runner in action, which is our automated model. With your system, you will have your GSET, which comes in the hard case, and your 3 items there. And so I have them unwrapped here. You should always handle these with gloves. They are like surgical instruments. The instruments do not come in a sterile condition, but they are from the factory. The manufacturer suggests that you do sterilize them prior to use, and of course you must sterilize them after each use. This is the wire speculum for inserting into the vagina, and it has a series of dots and lines. And the dots correspond to these wires, which the laser will not go through. So there are spaces that may not be treated, and that's why we get into the protocol of turning, which we will go into in depth when we go over the protocol with the thermal papers. The second item will be the GA adapter. The GA adapter stands for gyne and angled. As you can see, there's an angled mirror here. And I'm going to show you how to take this apart for cleaning. And thirdly, there is the GC. This is the gyne and circular or conical adapter. And you can see that the mirror is cone-shaped. And I'm going to take that apart for you as well. They have sort of specific cleaning routines. Of course, anything that is the silver should be maintained according to provincial standards, which you may have different province to province, so it's important to look those things up. The manufacturer has the guidelines already in the manual. To remove the mirror from the GA adapter, you need to remove the screw cap, and then the angled mirror will come out. Then for the GC adapter, this one, you can see there is a notch here. This is so that we take this screw cap off. And this is how our cone-shaped mirror is put in and removed. I find the easiest way, this one is sort of self-explanatory, it goes in there. This one, because of the notch, that's the only way that this mirror can get into this adapter. There are 2 flat sides of the mirror, and you can see there are 2 bars. This, you try to aim those, the flat bars, and then it will become seated down. To then put the screw cap on, I always put my finger behind, because after a few tries, you will notice when you're trying to screw this on, the cone-shaped mirror will pop right out. So if I hold the back of it, then we can easily put this back on. For these angled mirrors, you can see some are scratched and brown spots. So I always make sure that I keep them separate, because this cone-shaped mirror is extremely sharp, and if you put them together, they're going to scratch each other. Also, before cleaning, these mirrors can be autoclaved after cleaning. I do find, though, that that also can contribute to the brown marks and staining. If you do not clean all of the proteins off the mirrors, then when you autoclave, you will be steaming them and basically baking on the proteins to the coating. So sometimes they look very clean, but when they come out of the autoclave, you realize they're not.